Good evening and welcome to our COVID-19 update. I'm Neota Egbe. Here are the stories we lined up for tonight. Russia presents samples of its homemade COVID-19 vaccine to Nigeria. The federal government says it will be subjected to evaluation. Resident doctors declare a nationwide industrial action to protest non-payment of COVID-19 hazard and other inducement allowances. The World Health Organization says widespread COVID-19 vaccinations are not expected until mid-2021. Now, the Russian government has presented samples of its homemade COVID-19 vaccine to the federal government, but the Minister of Health, Osagie Ihaniwe, says it will be subjected to evaluation by the National Agency for Food and Drug Administration, NAFDAC, and the National Institute for Pharmaceutical Research. The vaccine samples were delivered today by the Russian ambassador to Nigeria, Alexei Shevarshin. A statement from the Ministry of Health says the Russian ambassador also submitted, along with the vaccines, an aid memoir which explains the details of the vaccine to enable the Nigerian government conduct further research on it. Meanwhile, the Minister of Health notes that Nigeria has been participating in a series of knowledge exchange and contacts with different research bodies and countries to find solutions to the COVID-19 challenge, and had contacted the embassy of the Russian Federation in Nigeria for rights of access immediately the Russian COVID-19 vaccine was announced. The Nigerian Association of Resident Doctors has declared a nationwide industrial action beginning from Monday, the 7th of September, to protest the non-payment of the COVID-19 hazard and other inducement allowances. The president of the association, Aliyu Sokomba, said in a communique at the end of its virtual executive council meeting that the federal government has continually failed to honor the agreements reached with the doctors during the previous meetings to forestall this industrial action. The doctors had in July this year issued a 21-day ultimatum to the federal government to address issues raised. An ultimatum, they say, has elapsed on the 17th of August. Now, political parties in Imo State have begun to jostle for the replacement of late Ben Uwajumogu, who was formerly the representing Imo North Senatorial District following the Independent National Electoral Commission's new date for the by-elections. The state COVID-19 task force says it is putting measures in place to ensure that all COVID-19 protocols are adhered to during that elections. Our correspondent, Tokwe Kutei, reports.
The Independent National Electoral Commission, INEC, has fixed 31st of October 2020 for the Imo North Senatorial District by-election to replace late Senator Ben Uwajumogu, who was earlier representing the Senatorial District at the Upper Legislative House. And for this, the COVID-19 task force in Imo State says it's collaborating with INEC to ensure that all COVID-19 protocols are being adhered to during the campaigns and during the election proper. The chairman of the COVID-19 task force in Imo State, Professor Morrissey, disclosed it at a briefing in Owerri, the Imo State capital. He also complained about the complacency of indigents to the COVID-19 protocols in Imo State.
That there is some laxity across the nation as to observance of the guidelines that we had given earlier about COVID-19. Why that is very sad, in the sense that the virus has not gone away. People are also dying. At this stage, we are actually appealing to people or reminding them for their own personal safety that they should observe those guidelines, even if others are not observing them. What do I mean? Even if you go into a crowd and people are not wearing face masks, you should take personal responsibility to protect yourself from possible contamination and then having been infected by others.
With 529 confirmed cases of coronavirus disease in Imo State, we hope that political parties and all stakeholders will adhere strictly to the COVID-19 guidelines to contain the spread of the virus during the election. From Owerri, the Imo State capital, Tokwe Kutei for COVID-19 update.
And while the election officials are preparing for the primaries and the by-elections in Imo State, the aviation sector is opening up. The Federal Airports Authority of Nigeria says 3 airlines are expected to fly into the Murtala Mohammed International Airport of Lagos on Saturday. The managing director of FAN, Captain Rabiu Yadudu, made this known during an inspection tour by the Lagos State government to check the readiness of the airport. The inspection team at the Murtala Mohammed International Airport included Lagos State Deputy Governor Bafemi Hamzat, the State's Transport Commissioner Frederick Oladende, as well as the State Health Commissioner Akin Abayomi, amongst others.
A blue canopy welcomes passengers traveling through the international airport in Lagos as they face the new normal of temperature checks and baggage disinfection. Within the terminal, social distance markings dot the floor. While sanitizer stations take the walls. Beyond this, the Lagos State government comes calling to check preparedness as international operations are set to resume. A short tour of facilities then follow with a stop at the point of entry.
First of all, before they come, they are supposed to come with a negative COVID-19 test, which will not be more than 96 hours.
When the visit is over, the Deputy Governor of Lagos asked Nigerians to stay within the COVID-19 protocols.
The facility is ready, is prepared, but people must still follow that instruction. So when people come in from their flights, there will be staff that will direct them what to do, how to do it. We must just listen to the officials.
The international airport in Lagos will have 3 flights on its schedule on Saturday.
We were expecting 3 airlines tomorrow, starting with Middle East Airlines around 2 p.m. tomorrow afternoon.
15 airlines, which include British Airways, Delta Airlines, Kenya Airways, and Egypt Air, among others, have been approved to fly into Lagos and Abuja International Airports. Kola Joe Uketumbi, Channels Television News.
And now we're being joined by an aviation consultant to look at this plan to open up the airports and the aviation industry in Nigeria. Mr. Bernard Bankole joins us via Skype. Thank you for joining us, Mr. Bankole.
Thank you very much.
Okay, so this whole thing, a lot of people are excited that the aviation industry is gradually opening up. Even the international part of travel is also opening up as well come Saturday. But what do you think Nigeria is ready for this?
Well, amongst the travel experts, it's a great excitement after being locked down for about 5 months doing nothing, and knowing fully well that the traveling public are yearning to get out of where they are, to move up and down. I think the government has done very well in terms of preparation, and we've seen the protocol plans. We've engaged the entire stakeholders in the aviation industry to ensure that the protocols are maintained. So I think we're more than ready, and we're looking forward to a great start.
Let's look at some of those protocols. I mean, anyone coming into Nigeria must have tested negative at least 7 days before departure, but preferably 72 hours pre-boarding. You think that will be enforced? Is it enforceable? And how effective would it be?
Well, you must agree, you must understand that it's a global pandemic, and every country on earth has been affected by this pandemic. So every country has put up a protocol that ensures that wherever they're coming from, they've been tested, and when they're coming into Nigeria, they're equally going to be tested. This will definitely mitigate the risk of spreading this dreaded disease into the country, or it being imported into the country. I believe so well that the protocol that has been put in place by those countries, as well as the one our federal government has been able to put in place, will definitely almost eradicate any form of importation of COVID-19 into our country. So it's a welcome idea.
Well, but that matter of perhaps some specified laboratories that will be looked at, do you think the government is in talks with certain laboratories in certain countries? Because It's said that some countries will require that the results must come from certain laboratories.
Well, the good thing is that the state government as well as the federal government have accredited some laboratories. And not only that, a website has been created where you're going to upload the negative test of your COVID-19. So before your arrival into the country, an assessment has been carried out. And upon arrival, it is easy to assess you with all the protocols that have been put in place. I mean, this is a well thought about process. You must agree with me that the federal government had earlier announced 29th of August before it was moved to 5th of September. And the reason it was moved was because they were trying to put finishing touches to ensure that this process is smooth and it does not affect the country negatively that would lead to us closing up again. So I think that all the necessary steps have been put in place, and it's going to be extremely difficult for it to be violated.
But let's look at that matter of social distancing in terms of our officials at the airport. Do you see them observing this effectively, even with all the markings on the floor? I mean, I've gone through the airport recently and I've noticed that some officials were not really paying attention to the markings on the floor. How much more the passengers?
Well, that comes with high level of discipline. Now, I must say this to you, that the airport officials have put in place the processes and the protocol to be followed. However, it is not left for the people to adhere strictly to it. Yes, we will see 1 or 2 people violating, and a lot of awareness have been created amongst the people. Like, it's been made compulsory that you must wear your face mask. It's been made mandatory that you must maintain that social distance. However, if it's being violated, trust me, all the people around you will caution you and make sure that you're doing the right thing. I believe that this is a collective effort. It's not just for the government alone. It's a collective effort from every responsible Nigerian. Every responsible traveler must adhere strictly to these rules. And once they are able to do that, I can say to you that some of the measures that have been put in place is that the trolley that we normally get porters to assist you with, all those things have been taken care of. So you're going to take your trolley, which has been sanitized, which you're just going to pick your luggage and off you go out of the airport terminal. So they put in measures. The question now is, how well are people going to adhere to these measures? But I know that with the measures that the government has put in place and the level of enforcement they intend to do, the level of violation will be very minimal. Trust me. Nigeria loves to live, not to die.
Indeed. But that matter of the number of airlines that have been given permission to fly into the country, just 15 or thereabout. For one who is in this industry, how do you think the other players in the aviation sector would react to this? Is it a question of what's being done to Nigerians flying out is what's being meted out to these ones that are not allowed in?
Well, for the case of reciprocity, I think that the government has taken the right decision. It's just normal. If you're saying that Nigerians cannot come into your country, and it just doesn't make sense to bring citizens of such country into Nigeria, I think there's absolutely nothing wrong with that. The only thing that I find a little bit disturbing is the fact that now we're cutting the numbers of passengers that the airlines could pick to a maximum of 200 passengers in an aircraft. Now, what that means is that the cost of tickets is going to go up, because you must understand that these airlines are in the business to make profits. And if they're going to make profit, it means that they're going to sell tickets that are high yielding, considering the fact that they've been cut off to let go of some passengers. So they will sell more expensive tickets. However, We've had a meeting with the DG of SCA, and he has given us some level of assurance that the numbers are going to increase from time to time. Let us start off with a particular number. So we're keeping fingers crossed, hoping that after the first week or two, we're going to see additional measures that would lead to increasing the numbers of people coming to Nigeria. And more so, in another 1 or 2 weeks, we might see those countries that have said that Nigeria can't come into their countries. We might see them opening up in another 1 or 2 weeks. So I see this being a matter of timing, and everything will change in favor of the country.
Now, we've been talking about those coming to Nigeria. Let's talk a bit about those Nigerians who are traveling out from here to other countries, and indeed other citizens of other countries who will be leaving Nigeria to other countries. What should they have in mind as they prepare to head out?
Well, first thing first, unlike before that you get your passport ready and you get your visa next, the first thing you get ready now is your COVID-19 negative result. That is the first thing you pick. While you pick your passport next and ensure that your visa, then you're ready to fly. However, the federal government has made it possible that nationals of all those other countries could go out. For instance, if you're carrying a foreign passport, you can go into all the other countries without, even though Nigeria has restriction, you can, because of your blood or what we do. But those measures have been put in place to favor those people. So it's going to be seamless for people going out and people coming in, as long as the protocols that have been put in place are not breached in any way or any manner.
Thank you very much. Mr. Bankole Bernard is an aviation consultant. Thank you for sharing this evening with us.
Thank you so much. You're most welcome.
When COVID-19 continues with a look at what's happening in Yobe State, again, the Independent National Electoral Commission, who's really having a challenge in conducting elections within this pandemic, has asked all political parties in the state to comply with the Nigeria Center for Disease Control's protocols for safety. The executive chairman of the commission, Mr. Maman Mohammed, disclosed this today in Damaturu. He was briefing journalists on the level of preparedness for the chairmanship and councillorship elections. According to him, the primary elections will commence on Monday, 7th of September 2020. He urged all stakeholders to keep watch of their members and make sure that safety measures are strictly adhered to.
After a series of representations from selected stakeholders and taking into consideration the elaborate planning needed to comply with the COVID-19 protocols and guidelines by all election stakeholders, the Commission is compelled to review the schedules for the election. We appeal to the public to always respect the federal government's elaborate protocols on COVID-19, and we assure our stakeholders that all relevant government agencies, that is this commission, will always promote and enforce the COVID-19 protocols in the district.
And when COVID-19 studios return, we'll be looking at what's happening in Adamawa State, where their schools are preparing for. Welcome back to a 9 o'clock edition of the COVID-19 studios, and we're off to Adamawa, where private school proprietors are wanting the government to provide certain things before schools reopen as soon as possible. According to the state's chairman of the National Association of Proprietors of Private Schools, Christopher Fwa, despite several promises made by the government to assist private schools facing serious challenges due to the COVID-19 and closing of schools, nothing has been done to assist.
Proprietors of private schools, unlike their counterparts in public schools across the country, have continued to suffer as a result of the impact of the COVID-19 pandemic. Teachers of the private schools have not been able to earn their pay for months due to the shutdown.
Government have never assisted the private school.
This school owner in Yola laments teachers' state of affairs and hopes the situation will change too.
It's really sad and painful because we cannot pay our teachers. It's just unfortunate. And I think people should know we are complementing government efforts. Private schools are doing a lot of things. And if not because of some of the private schools, I don't think the level of student to be admitted in the government in Adamawa State would have been high. Of the good performance comes from the private school. I think the government and other wealthy individuals should assist because everybody who has a private school is a sacrifice. We are not richer than anybody.
The chairman of the National Association of Proprietors of Private Schools says lack of job is affecting the mental health of many members of his association.
A very difficult time. After COVID-19 has gone away, private schools are still in place and they can take up the challenge and continue. Because otherwise you have a situation where if nothing is done, you have a situation where we'll wake up tomorrow and a lot of private schools have collapsed.
The national coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliu, on Thursday advised that states should conduct risk assessment to ensure that all schools are at a level of compliance and create a monitoring mechanism to assess, create, and monitor this level of preparedness. He said if there will be opening of schools, it must be staged and preferably carried out in phases to ensure that this does not pose a risk to the general public, and in particular to vulnerable groups that might end up getting infected by students going back home. The teachers in Adamawa are therefore appealing to the state government to quickly fulfill all the conditions such that schools may reopen as soon as possible.
Well, according to the Nigeria Center for Disease Control, NCDC, between August and September, the number of states with over 1,000 confirmed cases increased from 10 to 12, and the FCT. On case fatality ratio, the Presidential Task Force on COVID-19 says this has consistently remained at 1.9%, indicating improved case management, resulting in fewer COVID-19 deaths. Last night, the center reported 124 new cases in 12 states, the FCT, and 21 deaths in Nigeria. Lagos reported the highest number at 42, followed by the FCT. Plateau State did not report any case. The NCDC says that 20 deaths were recorded in Kaduna State in the past month, as reported by the government, and 1 death recorded in Anambra. 188 people recovered from COVID-19 in the last 24 hours in 11 states and the FCT. Plateau, 79, Ogun, 28, FCT, 22. Anambra had 13 recovering, Kano had 10 recovering, Edo, 8, Kaduna, 8, Gombe, 5, Rivers, 5, Lagos State, 2, Osun State, 2, and Oyo State, 1. Jigawa has not reported a case in the last 49 days. Kogi State in over 2 months, while Yobe State reported a case 35 days ago. The Katsina State government said it spent more than 157 million naira for COVID-19 tests in the state. The tests have been conducted a total of 10,000 from May the 31st, 2020 to date, and each test suspected cases of COVID-19 at a private Medicare center accredited by the Nigeria Center for Disease Control. The government says this amount is in addition to other costs on patients' care, welfare packages, and allowances for staff who work at 4 major isolation centers in the state. The State's Commissioner for Information, Culture and Home Affairs, Abdul Karim Sirika, who disclosed this at the Government House in Katsina, said each cost the state government 15,750 naira. That's each case.
There are 3 fixed sample collection centers in Katsina local government. We have the maternal and child health clinic at Kofarbuga. We have Federal Medical Center, Katsina. We have General Amadirimi Specialist Hospital. In all the other local government rapid response teams, lab personnel, assistant, DNRs, and what have you are present in the local government headquarters and the position to handle likely cases of COVID-19. Case findings through contact tracing is a continuous exercise. All residents of Katsina State that meet up the criteria for testing have their sample collected and tested free of charge. There are reports going on that the state government do charge some amount of money for testing. That is wrong. It does not hold water, it's a lie. So therefore, the testing is free of charge. Confirmed positive cases are admitted and treated for free in our designated isolation centers. It is not worthy to mention that more than 95% of cases admitted are symptomless. Some of these samples that some of the samples taken, they don't even show any sign of COVID-19. But if they are tested, you see them positive.
Non-compliance with laid-down safety protocols as stipulated by authorities remains a great challenge at the quest to flatten the curve of COVID-19. A visit to Ogun State's capital, Abeokuta, shows that at some parts and markets, the guidelines on face masks, social and physical distancing, amongst others, are very low. And to ensure these precautionary measures are adhered to at the grassroots, communities and religious leaders have been challenged to effectively engage residents at various levels.
At the community stage, you have a lot of people who probably do not believe that there is even COVID. If you look at the manner, the way people behave at the community level, it does suggest that these people are aware that something is on. And that's why we need sensitization. Community leaders, leaders of CDAs, ballets, and all those groups that are important in the sensitization at the community level, opinion leaders at the community level should be involved in the sensitization so that we do not relax and say the thing is over. Because if we let down our guard at this stage, what is happening in some other climes will happen again, where they are now having another kind of implosion, another round of COVID-19 infections, serious ones. So at the community level, what is important that we must continue to obey the protocols.
Joining us from our Abuja studio to look at the public health perspective to Nigeria's preparedness for the reopening of international flights is a virologist and public health epidemiologist at the Nasarawa State University, Dr. Akiala Ishaku. Thank you for joining us, Doctor.
Thank you, Neota, for having me. Thank you, viewers, for tuning in.
So let's start off with a look at the pre-departure protocols from exit country into Nigeria. Look at the entire protocol. What do you think, as a virologist, you think it's what it should be?
Yeah, so I want to align my thoughts to Bankole Bernard, the first guest that appeared and spoke about the preparedness. I want to commend the federal government and the aviation, federal Minister of Aviation, for putting that protocol in place. And I think it is quite commendable. It's just that as a public health expert, I have my shared reservation, and this includes that in all this protocol, even in the pre-departure exit from exit country, how do we know the number of accredited labs in those countries? Do we have a dashboard to be able to monitor that? This is a 21st century. I was thinking that by now we should be able to create what is called a biobanking, set up a platform, a dashboard for biobanking, where we can access results directly through a link from the countries all over the world where these COVID-19 tests have been carried out, and then we can be able to import them in. So by and large, it is a commendable effort, but we need to do more. And in all our preparation, I have not seen any testing panels in our airports. Neota, this raises question. I was thinking that we can open up and begin to set set up mini labs in our airports for on-spot test and assessment. Near we have testing panels now that you can just, in less than 1 hour, you can use a gene expert module to be able to do your testing, and within 1 hour, you can begin to get. And these machines, we have 4 modules, we have 16 modules, we even have 32 modules, so you can run 32 tests in 1 hour. So I was thinking that we can create a special lab in our airports, most especially in Lagos and in Abuja, to begin to have on-spot test analysis. In doing that, we can be able to generate a biobank, a repository, where experts in the long run can be able to perform research on this. The idea is that we are not only looking at COVID-19, but we can also look at other influenza viruses associated with upper respiratory tract infection, so that we can be able to keep track. Neota, we are living in a world that there is a concept of emerging and re-emerging diseases. So I think we need to plan for the future. My expectation is that we need testing labs in our airports.
But do you think the government is looking in that direction? I mean, beyond just allowing them coming with their test results, negative test results or PCR results taken 4 days before departure, and from some countries, specific laboratories, don't you think the government is looking in that direction as well?
Yeah, so let me share an experience with you. One of my friends is among the evacuees from one of the countries during this lockdown. He came in from Malaysia. He tested negative from the country where he was coming from. He came in, he interacted with friends, with families, and all what have you. His samples was taken in Abuja here. 7 days later, his samples turns positive. Now, as a country, we must be able to also work on our feedback mechanism and our contact tracing mechanism. We need to employ innovative tools, innovative models. My friend has to return back to a state where he resides to carry out another test again, which shows that he is positive, despite he's asymptomatic. The aviation industry never knew of this. I was thinking that he would have had a call from from a certain group of technical people that would have monitored him over time until when his laboratory results are out. So what we need to do as a country is to crash our turnaround time, to begin to see how fast results can be released on time so that people can be able to know their fate and begin to move on. So for every person that is coming into the country, my advice to key into the protocol that is in place is that samples can be taken. In fact, if we develop our capacity very well and our testing panel very well, within 1 hour within the airport, you should be able to have your COVID certificates as you come into the country, or you can have a designated place in your state of residence or where you are going, and then immediately you can be tested. Neota, I hope you know that it is people that traveled and came in that brought the first index case for COVID-19. We must be able to nip the risk index analysis very high in our airports and begin to make sure that we employ innovative tools to be able to track people that are coming in. In case we have positive cases, we should be able to have cluster contact tracing and begin to get their samples.
Are you of the school of thought? There are some people who are thinking in this direction that the airport hotels or the hotels around the airport should be emptied out so that those coming in are kept there for at least 3-4 days to ensure that the negative results they are coming in with are sustained before they are allowed to go. Are you in that school of thought?
I share that school of thought perfectly. In fact, Neota, we don't need to also wait for 3 to 4 days. We can empty the airports around the hotels around the airport, keep them. As I shared from the beginning, that there are testing panels like the Gene Expert that can be able to run 32 tests in 1 hour. So if you engage that machine for 10 hours, or you have like 10 of those machines and they run concurrently, you find out that within 1 hour, you have generated 320 results. So it's possible that we can have these hotels for 1 day, not necessarily 3 days, as we begin to empty them, because more flights, more people will be coming in. So I share within that school of thought that it is quite key. We don't need to expose the country to another second wave again as we begin to open our airports. It is quite key that we put these safety measures in place so that we can be able to keep track of all this.
Let's look at the protocols on board the flight. I mean, it includes face masks. For flights that are as long as 6 to 12 hours, some of those flights, you think the passengers can go through that wearing the face mask?
Yeah, so Nyota, let me confess to you that I have boarded a flight from Abuja to Lagos, and I can tell you the level of compliance even in the aircraft. Sometimes it's very difficult, and more so that there are a lot of people that have other comorbidities, like people that have respiratory tract distress, like asthmatic patients. You don't expect them to wear face masks for a long period of time, and that is why it is quite key for us to have the social distancing even in the aircraft, which is quite key. So I strongly believe that it is not possible for you to be in the flight for 6 to 12 hours and to be on face masks for a longer period of time. This is because a lot of people will have respiratory distress. But what is quite key is that if we maintain social distancing and compliance to the face masks at interval, we should be able to have a COVID-19 free reopening of our airports.
But what about the convenience? I mean, yes, the flight, the airlines have been told they can only carry at least 200 passengers. What about the use of the convenience? Is there no chance of transmission through the convenience?
So the chances of transmission through the convenience is very high. So in the concept of disease transmission dynamics, there are what we call fomites. Fomites are inanimate objects that can be able to transmit disease. So the door handles of the convenience is quite key. They need to be disinfected within interval periods of time. In fact, I was thinking that with the new innovation technology now, as we begin to check out of the convenience, there should be a fume, like a fumigation, because I've seen that in a lot of videos in YouTube. A lot of aviation companies are beginning to employ that technology. So aircraft in Africa should not be an exemption, that once you use a convenience, you check out immediately within seconds. The convenience is being disinfected, and then there are people there that should be able to also guide. And I think it is quite key for people to also be stationed on quite the number of times that people should be able to use the convenience. So it is quite key we begin to do that. But in doing that, coming from a research background, we need to also evaluate the aircraft. Neota, we have never done a lot of studies in our aircraft. I've never seen any study within Africa that shows that the virus can also be sustained in an aircraft. So I was thinking that agencies like NESTRA, we can be able to do an air quality assessment of our aircraft. We would have done that even within the domestic airlines. Begin to subject the air in the aircraft to check for air quality. This is quite key. It is one of the biological gradients to check hazard risk analysis. So I am thinking that in the next coming weeks to come, the National Research Consortium on COVID-19 will look into that direction to look at the environmental component and for us to also check for air quality, even in conveniences and even in our aircrafts.
Okay, so let me just say, passengers must present themselves for sample collection on arrival. Is that workable?
Yeah, it is workable because of the pandemic. But one aspect you need to also look at in ethics, in medical ethics, you have to also look at the issue of human rights and the issue of consent. There are a lot of passengers that may decline consent. So what I think in the clause within our protocol, we have not address people that would decline consent. Because if I boarded a plane and I came into the country and I decline consent that I don't want my samples to be taken, and I present a COVID-19 negative test, what happens to me? So I have gone through the protocol. I have not seen where it is in the protocol as mandatory. But I think that we need to also look at the flexibility of those protocol to look at where human rights can be factored into and issues of consent. Issues of consent are quite key, so that you don't take somebody's sample and then somebody begins to think else, that you have used his samples for other things. So we must begin to seek consent from passengers, begin to raise a form, an informed consent form for them to fill in, to act, to say yes. In fact, even before boarding, they should be able to fill those forms so that we can use that as a bait and we can use that to collect their samples. So I agree with that school of thought that collecting samples on arrival is quite key. Now, Neota, why do we need to collect samples? Is to protect the well-being of Nigerians and their safety, one. Two, to also generate a repository data bank for our people. Three, we can also use those data for research, for planning in the future, and also prepare for an emerging trends of pandemic that will come in the future. So we can begin to monitor and we can be able to keep track. In fact, I was also thinking that we can use technology that for people traveling out of Nigeria, instead of presenting a COVID-19 certificate to them in form of paper, we can translate it in form of a card that has a biochips. So we can look at that as a DNA card that has their medical certificate, so that subsequently, as they begin to travel, we can begin to update those cards with their bio data. And those cards can be able to capture their blood group, can be able to capture their full name, can be able to serve as a national DNA identity card that has all their medical history and also has. So that by then, we are beginning to build up a data bank and begin to have data for our subsequent planning.
All right, thank you.
So I think it's quite key that we collect samples on arrival.
Thank you very much, Dr. Akiela Ishaku, who is a virologist and a public health epidemiologist. Thank you very much. Now let's go on to South Africa, where the key COVID-19 indicators show a rise in recovery rate to 88% and declining test positivity rate at 11%. The number of confirmed cases now stands at 635,078, while nearly 558 have recovered. 115 more people died in the past 24 hours, taking the death toll to 14,678. The country has slipped from the 5th to the 7th in global COVID rankings. Health Minister Dr. Zweli Mkhize, speaking to Parliament this week, says the storm may just be over. While the government continues to appeal for more adherence, a health workers' union may just be brewing another storm on the side, with an 11-point demand for government to look into.
The National Education, Health and Allied Workers Union, NAHAW, in South Africa, say they're agitating for more protection for members on the COVID front lines. They've picketed, they've held memorial events for frontline workers who have died in the course of work. They have even marched to the union buildings and the parliament to hand over their memorandum of demands. And here's what they're asking for.
We call upon the Department of Health to issue a circular explicitly prohibiting managers from preventing workers to go on quarantine if they believe they have been exposed. We call on the Department of Health to mandate the daily screening of healthcare workers, and that it must roll out a national testing program of non-communicable diseases. We call on government to abandon the current decentralized and fragmented approach in the procurement of PPEs. We call on government to implement a risk allowance for all frontline workers.
More than 240 health workers have died and more than 31,000 have tested positive for COVID-19 in the country, according to the Health Minister, Dr. Zweli Mkhize. And NAHAW has given the government a week from Thursday to respond positively to their demands. If that is not done, they are threatening to withdraw their labor power everywhere their members are on the 10th of September. Their anger is not doused by the South African Auditor General, Kimi Makwetu's report this week on COVID corruption. Mr. Makwetu reported that many departments overshot National Treasury's recommended prices, paying 5 times more than they should have for personal protective equipment.
Even in this crisis, there is no way we can step away from the disciplines of transparency and accountability. And I think this report is going to give us a sense of clarity as to the areas of transparency and accountability that have already been compromised, and how best can we make sure that we bounce back by using a very strong instrument that is about supervising this thing to the level where there's a minimal opportunity for those that intend to cause harm in respect of diverting these funds.
More procurement processes are still being audited, and watchers expect even more worms out of the can. From Johannesburg, South Africa, Betty Dibia for the COVID-19 update.
And despite growing expectations around the world that the COVID-19 vaccine could be released within weeks, the World Health Organization says it does not expect widespread vaccination until 2021. The UN agency says no vaccine for the coronavirus should be approved for a worldwide rollout until it has undergone sufficient scrutiny and proved its safety and efficacy. Here's more on this and other developments on our COVID-19 Global Update.
The World Health Organization says it does not expect widespread vaccinations against COVID-19 until the middle of next year, stressing the importance of rigorous checks on their effectiveness and safety.
This phase 3 must take longer because you need to see how truly protective the vaccine is. You also need to see how safe it is. You need to understand whether there are things that there are earlier phases. You do look at safety, and you look at safety very, very carefully before you go into the phase 3. But you need to be following safety at all stages. So that makes it a longer process.
According to the WHO, none of the candidate vaccines in advanced clinical trials has so far demonstrated a clear signal of efficacy at the level of at least 50% sought by the agency. Meanwhile, according to research published in The Lancet, patients involved in early tests of Russia's coronavirus vaccine developed antibodies with no serious adverse effects. But experts say the trials were too small to prove safety and effectiveness. Russia granted regulatory approval to the COVID-19 vaccine in August after less than 2 months of human testing. In the meantime, the World Health Organization says that once a COVID-19 vaccine is approved, Africa will get at least 220 million initial doses. In other developments, New Zealand has recorded its first coronavirus death in more than 3 months after a man in his 50s succumbed to the virus. Health officials say the man was part of a second wave cluster of infections that emerged in Auckland last month, ending a spell of 102 days free of community transmission in the South Pacific nation. And in Europe, France has closed 22 schools following the resumption of in-person classes this week because of a surge in coronavirus infections. The country's education minister says overall, French schools have reported about 250 suspected virus cases per day since they started reopening on Tuesday. Italy's former Prime Minister Silvio Berlusconi is in hospital in Milan with early-stage double pneumonia after testing positive for coronavirus. The 83-year-old, who underwent a major heart surgery 4 years ago and halted all public appearances after the coronavirus pandemic hit Italy in February, says he feels fine.
And that's the package for our COVID-19 update program for tonight. Take a closer look at the global numbers in real time by visiting our website at channelstv.com. There you'll get more updates and better understanding of all you need to do to stay safe during this period. And of course, there are other stories on the politics side, business and sport. To join us for fresh packages of the program tomorrow, that's on Monday at noon, 6 p.m. and 9 p.m. Thank you very much for watching. I'm Nel Taigwe. Bye for now.